Would you like to be a key member of the surgical team responsible for assisting the surgeon and providing safe surgical care to patients? We invite you to learn about the surgical technology profession and discover how you can make a difference in the life of a patient. The surgical team is divided between two roles, non-sterile and sterile. The non-sterile individuals are the circulator and the anesthesia professional. The sterile duties are performed by the surgeon and the certified surgical technologist, or CST. The circulator is a registered nurse, or RN, who is responsible for providing support to the sterile team members and anesthesia professional during the surgical procedure, such as performing the patient's skin prep, connecting cords to the machines, completing various documents including operative record, and applying sterile surgical dressings. The anesthesia professional is either a physician or a certified registered nurse anesthetist. Responsibilities of the anesthesia professional include administering anesthetics and drugs and monitoring the patient's vital signs. The surgeon is responsible for carrying out the surgical procedure. He or she is responsible for all the actions of the surgical team during the procedure. The surgeon may be a medical doctor, or MD, doctor of osteopathy, or DO, doctor of podiatric medicine, or DPM. CSTs are an important member of the surgical team who work closely with the surgeon under his or her delegatory authority and supervision. Surgeons rely on CSTs to be able to think like the surgeon in order to anticipate their needs during procedures. The skilled CST demonstrates a caring attitude towards the patient and surgical team members. This includes being an effective member of the team and communicating efficiently. They understand detailed anatomy and physiology, the pathological condition affecting the patient, and the planned surgical procedure. CSTs are skilled in the practice of sterile technique to preserve the sterile field to protect the patient from acquiring a surgical site infection. The primary role of the CST is called the first scrub role. It involves the three phases of surgical patient care: preoperative, intraoperative, and postoperative case management. Preoperative duties include performing the surgical scrub and donning the gown and gloves, preparing the sterile equipment, instruments, and supplies, performing counts, and assisting the surgeon in placing the drapes. The intraoperative phase of the procedure includes passing instruments and supplies to the surgeon, passing tissue specimens to the circulator, passing suture to the surgeon, and assisting in applying sterile dressings. The last phase of surgery, postoperative case management, involves preparing the equipment and instruments for transport out of the OR and assisting the circulator prepare for the next procedure. Surgical technology students complete an accredited surgical technology program and earn an associate degree upon graduation. Some of the coursework includes anatomy, physiology, and pharmacology, surgical instrumentation and equipment, and patient care concepts. Learning occurs in the classroom, mock operating room, and surgical rotation. The National Certification Examination is administered by the National Board of Surgical Technology and Surgical Assisting, or NBSTSA. Upon passing the exam, the individual is allowed to place the CST credential after their name. The certification cycle is for 2 years. There are states such as Indiana, New Jersey, South Carolina, and Texas that require graduation from an accredited program and the CST credential. Additionally, many employers require the CST credential. The job outlook for surgical technology is very positive. The U.S. Bureau of Labor Statistics reports that surgical technology is projected to grow faster than the average for all occupations. The primary area of employment for CSTs is in the operating room. Other employment options include team leader for surgical specialties, traveling CST, healthcare sales representative, and surgical technology program educator. The Association of Surgical Technologists, or AST, is the professional organization for surgical technologists. AST supports program accreditation, national certification, and continuing education. AST member benefits include student membership in the AST Student Association, discounted registration fee for the national conference, access to online continuing education and professional resources, and the AST monthly journal, The Surgical Technologist. Most importantly, members serve as an advocate promoting the profession by attending state assembly meetings, involvement in state legislative activities, and serving on state and national level committees and boards. We encourage students to become involved in the profession and AST while attending the program and after graduation. If you need additional information, please visit the AST website, ast.org, or call us at 800-637-7433. AST wishes to thank Concord Career College for their support in the production of this video.